Margaret Collins was 67 years old when she began to notice something that made her uneasy. For decades, she had always had relatively good vision. She enjoyed reading before bed, doing crossword puzzles in the morning, and driving to the neighborhood market. But in recent months, something seemed different. The letters in books looked slightly more blurred, the streetlights at night created a faint halo of light, and sometimes she had to hold her phone much closer to her face just to read messages. At first, Margaret believed this was simply a natural consequence of aging. Many friends her age also talked about tired eyesight, so she thought there wasn't much she could do other than buy stronger glasses. But one morning, while trying to read the label on a bottle of medication, she realized her vision was worse than she thought. The letters seemed out of focus, and her eyes felt more sensitive to the bright light in the kitchen. That was finally the moment she decided to seek help. Margaret scheduled an appointment at the office of Dr. Ethan Walker, a specialist in eye health and visual nutrition. During the consultation, she carefully described her symptoms: difficulty reading, slightly blurry vision, tired eyes at the end of the day, and more difficulty seeing when driving at night. Dr. Ethan Walker listened carefully. After a few basic tests, he explained something many people over 60 years old eventually discover. Vision can change with time, but many of those changes are connected to factors influenced by daily habits, especially diet, exposure to blue light from screens, and levels of oxidative stress in the body. He explained to Margaret that the retina, the part of the eye responsible for capturing light and sending signals to the brain, is one of the most active tissues in the body. That means it constantly requires antioxidant nutrients to protect its cells. When those nutrients are lacking, or when the body experiences excessive inflammation and oxidative stress, the retinal cells can begin to lose efficiency. That's why some people begin to notice symptoms such as blurred vision, difficulty reading, or sensitivity to light. During their conversation, Dr. Ethan Walker asked Margaret about her eating habits. She admitted her diet wasn't the best. Many meals were quick and rarely included dark green vegetables or foods rich in nutrients, specifically beneficial for the eyes. That's when the doctor began explaining something many people don't realize. There are natural nutrients that help protect eye health, especially compounds known as lutein and zeaxanthin. These compounds work almost like a natural filter inside the eyes, helping protect the retina from damage caused by intense light and cellular aging. Dr. Ethan Walker explained that one of the foods richest in these nutrients is something extremely simple and accessible: spinach. Spinach contains an important combination of lutein, zeaxanthin, vitamin A, vitamin C, and vitamin E, nutrients that researchers often associate with protecting eye cells. Consumed regularly as part of a balanced diet, it can help support retinal health over time. Margaret was surprised to learn that something so common in the kitchen could be related to eye health. But Dr. Ethan Walker also made it clear that there is no single miracle solution. Protecting vision involves a combination of factors, such as maintaining a diet rich in antioxidant nutrients, reducing excessive consumption of refined sugars, protecting the eyes from excessive blue light, and ensuring the body receives essential vitamins like vitamin A, vitamin C, vitamin E, zinc, and omega-3. At that point in the conversation, he mentioned something he often shares with patients who want to learn more about natural ways to care for their eyesight. He explained that some people prefer to explore this information in a more organized way, understanding better how to improve vision, reduce blurry sight, avoid problems like cataracts, and discover which vitamins help maintain healthy eyes over the years. For that reason, he mentioned that for those interested in learning more about this topic, there is an explanatory guide that gathers several practical recommendations for eye health. He explained it simply: if you want to better understand how to improve vision, reduce blurry sight, avoid cataracts, and discover which vitamins help protect eye health, we left a guide in the first link in the description that explains all of this in more detail. Margaret decided to start with small changes. She began including more green vegetables, especially spinach, in her weekly meals. She also started paying more attention to her overall health, reducing highly processed foods and increasing her intake of antioxidant-rich foods. A few weeks later, she returned to the clinic for a follow-up. Although visual changes don't happen instantly, Margaret reported that her eyes felt less tired at the end of the day, and that she was now more aware of the habits needed to maintain healthy vision. Dr. Ethan Walker emphasized that the most important thing to understand is that vision doesn't depend only on occasional medical visits. It is also connected to the choices we make every day, from the foods we put on our plates to the habits we adopt to protect our eyes. Before Margaret left the clinic, he repeated something he often tells many patients. If you want to discover more practical ways to take care of your vision, avoid cataracts, and learn which vitamins help protect your eyes. The guide we left in the first link in the description gathers many of these ideas in a simple and easy-to-understand way. Margaret left the clinic with a different feeling. She realized that aging does not necessarily mean accepting gradual vision loss. With information, healthy habits, and the right nutrients, it is possible to support something extremely valuable: the ability to see the world clearly.